This past November, my 5-year-old son Dominic was complaining of a headache. I told him he just needed to get some rest and he should feel better. The next morning when he woke up, he couldn't walk. It was as if he had spun around several times and tried to walk in a straight line. He just couldn't do it. We took him to the hospital, and after many tests, they decided to do an MRI, a magnetic resonance image of his brain. Immediately after it began, the doctors came out, and my husband and I were in shock when they told us that Dominic had a large tumor in his brain. Hello, my name is Angela, and today I'm going to talk to you about pediatric brain tumors. How many of you have children or know someone with children who've experienced a common problem like headache, nausea, or even clumsiness? Even the simplest things can turn out to be more serious than you ever imagined. Ever since my son's diagnosis, I've been doing research on pediatric brain tumors and getting information from his neurosurgeon and oncologist. I will be going over three main points. First, I will go over some general knowledge of pediatric brain tumors. Second, I will discuss the symptoms involved. And finally, I will discuss the available treatments. Now, let's start with some general knowledge of pediatric brain tumors. There's some information commonly associated with the tumors. According to the American Cancer Society, brain and spinal cord tumors are the second most common cancer in children after leukemia. The American Cancer Society also estimates that 3,200 tumors of the central nervous system are diagnosed each year in children under the age of 20. The most common brain tumors found in children are astrocytomas, which are most often benign. Benign means that the cancer isn't expected to spread and typically means low risk. However, benign brain tumors are still considered high risk because of the pressure placed on the surrounding areas of the brain. The causes of a pediatric brain tumor are still unknown, but there have been theories. Catherine Warren, PD, MD, a pediatric neuro-oncologist at the National Cancer Institute, states, although only 1% of childhood brain tumors are detected at birth or in the first few months of life, a significant number are diagnosed before age 5, suggesting a developmental defect. Now that you have some general knowledge about pediatric brain tumors, let's discuss the symptoms. There's many symptoms to watch for in children. Many of these symptoms are similar to those of other childhood illnesses. Some of the most common symptoms are headaches, nausea, vomiting, loss of balance, vision problems, and fatigue. There are some symptoms that are less common but much more severe. These include seizures, problems with speech, changes in personality, or even memory loss. If any of these symptoms persist, a doctor will perform a neurological exam and determine if a CAT scan, a special X-ray of the brain, or an MRI is needed. Now that we've discussed the symptoms, let's go over the available treatments. There's several treatments available depending on the risks involved. Sometimes the best treatment is no treatment. This is if the tumor is located in a high-risk area, and sometimes the decision will be made to observe the tumor and its growth over time with periodic MRIs. Another option is surgery. If the doctor feels the tumor can be removed safely, they will go forward with the surgery. This typically leads to the best long-term prognosis. It's still considered risky, though, due to the common complications of surgery. The entire tumor may not always be removed, but it helps relieve many of the associated symptoms. Another option is chemotherapy, which involves the use of the injection of powerful drugs to kill the cancer cells. This can be administered either orally or intravenously. There's some side effects from chemotherapy, though. Some of these include hair loss, mouth sores, loss of appetite, and fatigue. The final option is radiation therapy, which is a high beam of radiation is used to pinpoint the cancer cells without affecting the surrounding tissues. Typically, this is used when the tumor is not fully removed from surgery and the doctors feel that it will continue to grow. This is also not commonly used on children under the age of 3 due to the unknown long-term effects on their developmental growth. So that's a brief look at the treatments of pediatric brain tumors. I hope that this presentation has given you new insights about pediatric brain tumors. Today I covered some general information, the symptoms, and the available treatments. My son Dominic had his tumor surgically removed. He has recovered well, and he's running and walking and functioning as if nothing ever happened. He does still have some of the tumor remaining in his brain, though, and it might stay there for the rest of his life. Just depends on if it's growing or not, which we will have to do the occasional MRIs. However, he is always in good spirits, and he continues to enjoy every day like a normal 5-year-old boy should. Thank you.